Greetings. My name is Melanie. I'm the Cannabis Doula, and today I am recording a very special video, which will be an update video to a video that I posted earlier where I was wearing the same shirt, and it's entitled The Cannabis Doula, Cannabis Use During Pregnancy, Childbirth, and Postpartum. And in that video, I was actually introducing my work and the work that I do through the cannabisdoula.org. I wasn't necessarily providing information on cannabis use during pregnancy, but I was more so stating that I support and provide consultations to women and families who are interested in using cannabis during pregnancy, childbirth, and postpartum. So I'm just doing an update video today, introducing myself and just kind of giving an update on the work that I've been doing through the past couple months since I first recorded the video where I was wearing this shirt. So what is the Cannabis Doula? I support women and families who choose to consume cannabis, especially during childbirth, pregnancy, and postpartum. I provide education, resources, research, and overall support and community to families who are interested in learning more about cannabis use in general and are incorporating it into their lifestyle. Or families who are expert cannabis users and are curious about the benefits of using cannabis and how it can be safely used during pregnancy, which is very important. So I provide those resources. I think harm reduction is one of the most important things that we should be talking about when we are talking about women who are consuming cannabis when they are pregnant. We know that cannabis is the most consumed illicit drug by pregnant women. And so there are ways that women can reduce harm, and I'm on a mission to support women in learning those methods of harm reduction and also risk management as well. So there are risks associated with cannabis use, whether you're pregnant or not, but especially when you're pregnant. So I educate women on those risks and how to manage those risks so that you can go on to have a happy, healthy pregnancy and, of course, a happy, healthy baby, which is obviously our goal. We've done a lot of work in getting our mission out and shattering the stigma associated with cannabis use during pregnancy. Last year, 2019, we had a lot of discussions and sessions incorporating cannabis into those conversations. We got together with women and moms. I did a lot of interviews, talking to a lot of different people. I did a panel discussion at the Women Girl Leadership Summit on the topic of cannabis and family wellness. That was in June of 2019. I think that was one of the highlights of my year. If you're subscribed to my newsletter, then you know I mentioned it as one of my highlights for 2019. And also we ended the year with our final cannabis sesh celebrating Kwanzaa and really incorporating the ancestral connection that Black people have with cannabis to our lifestyle and our use, and just giving thanks to our ancestors who cultivated hemp as a cash crop during the transatlantic slave trade. Cannabis traveled all the way from Africa to various parts of North and South America with those enslaved African people. So I honor my ancestors every time I talk about cannabis. And it's a very big part of my culture. And I'm always going to be talking about the history of cannabis and how it affects our people and how we can best incorporate cannabis into our lives and using it in a healthy manner so that we can obviously reap the benefits of CBD and THC. So I'm always providing education about cannabis. I've been a recreational cannabis user since 2010 when I was in college as an undergrad. I started using cannabis recreationally. I was actually majoring in family and child studies, and I have my Bachelor of Science in family and child studies with emphasis in family social services. Since I started using cannabis in college, I had made the dean's list during the remainder of the semesters while I was in college. In 2015, I moved out to D.C., and I started working as a cannabis cultivator, and this is actually the shirt that I wore when I had took the picture for my first cultivation license. So this shirt is very meaningful. I think I mentioned it in my other video. So yes, I always wear it. I have it on again to kind of honor that moment in time. I actually got pregnant while I was working at the cultivation center growing cannabis. And I worked there up until I was like 5 months pregnant. And I faced like a lot of stigma, of course, as a mother working, obviously growing cannabis, and just as someone who was consuming cannabis prior to she got pregnant, and just people's thoughts about that in general. But I had experienced a lot of benefit of using cannabis while I was pregnant. I had a lot of pain, nausea. So using cannabis really helped me. And from my experience in using cannabis when I was pregnant, I started talking to other women who were using cannabis as well. And we obviously had no one to talk to about it. And so I started to educate myself more. I received my master's certification from Cannabis Training University originally. And then I started working as a doula and advocating more for women. I was interviewing a lot of women about their consumption, asking them questions, and seeing what they were using the cannabis for. And a lot of them were actually using it for very severe nausea. And they talked a lot about how nothing else that the doctor prescribed was working, or they didn't want to take certain medications. They felt that it was harmful to them and their babies. I was also feeling that same way. Like, I wanted to have a natural childbirth, and I used cannabis to help me accomplish my goal. I had 2 natural childbirths that were largely pain-free. I was in labor. My birthing time was only an hour. And especially for my second birth, it was a very orgasmic experience. And I think that more women should have access to cannabis and should be able to receive education about how to properly consume it and how it can be used if you choose to use it. And I'm not definitely advocating for women to just start using any cannabis, and that's why I'm so particular about the information that I put out online. So I won't necessarily make a video about cannabis use during pregnancy, because I'm more so interested in educating women on an individual basis. I think putting out like a bunch of information and just not talking to women about harm reduction and how cannabis affects our bodies differently, and also how all the cannabis that we're consuming may not be safe, and how to choose quality cannabis is another very important thing that I educate women on, especially in a time where we get most of our cannabis from men, and we don't really know what it should look like or what it should smell like. And that can be a very dangerous thing, especially when you're pregnant. So I've been really putting forth the effort to not only educate myself, but educate other women as well. So yeah, I'm a 2-time champ. I'm a cannabis mom, as I like to call myself. I still use cannabis. I'm a medical cannabis patient since 2019, last year. And I'm using cannabis for a variety of different things: anxiety, depression, PTSD. Those are some of the symptoms that I'm treating with medical cannabis. And I'm also using it to treat cancer and to heal my thyroid as well. If you've been following me on this channel, then you know I've been experimenting with different methods of consumption and different dispensary products. And you can follow my journey where I'm going to different dispensaries and trying different things, making oils and trying to consume cannabis in a variety of different ways. So harm reduction is like a set of practical strategies that people put in place to reduce harm that is often associated with drug use. One way of reducing harm in cannabis use specifically, in my opinion, is educating women on how to properly consume cannabis and how to properly and how to actually determine the quality of the cannabis that they're consuming. And so as a professional interpreter, one thing that I do is help families, help women to choose quality cannabis. You always want to make sure that you're picking cannabis that is grown properly, cannabis that is free of pesticides, and cannabis that has been lab tested, that doesn't have mold or bugs. And you need to be able to determine those things when you're consuming this medicine. So if you want to go online and check out the Cannabis Doula Principles of Harm Reduction, I encourage you to do so. I have a set of principles that I am hoping to get out to hospitals and birthing centers about how to work with women and families who are consuming cannabis and how to educate them on harm reduction. I'm actually hosting a webinar tomorrow night. If you're interested in getting access to the webinar, definitely sign up for my newsletter. Send me an email to get details and get the password to get access. I'll be talking about harm reduction, some practical steps that you can take to reduce harm if you're using cannabis when you're pregnant or nursing. I'll also be talking about research. So that's a very controversial topic when you're talking about cannabis and pregnancy, the research. Like, where is the research? Is it biased? And what are they saying? So I'll be talking about all of that as well. I'll be giving advice about how to talk to your doctors about cannabis. And really giving you some tips to kind of help you if you're a cannabis using mom or a cannabis using advocating for cannabis use as a doula or birth worker. Then I give some tips on how to provide a social support for women who are using cannabis and the importance of providing community for women who consume cannabis. I think it's a very isolating thing, especially now on the verge of legalization in different states, and just the popularity, I guess, of cannabis now and more women using it. I think it's very important that we provide community and shatter the stigma that's associated with our cannabis use so we can best support women in having healthy babies and safe, pain-free births. It is really important for me and my mission. So I'll talk about some of the risks associated with cannabis use during pregnancy specifically, and how to manage those risks with evidence-based information. And like I said, with support and providing community, especially through connecting with other cannabis moms and shattering the stigma. And of course, education with the Cannabis Doula. I do offer consultations as well, and my consultations have been going wonderfully, and their price is actually going up for 2020. So if you are still interested in getting a consultation at last year's rate, do so now, because I am raising the price for consultations to $125 for 1 full hour of consultation. And with that, you do get an individualized Cannabis Doula care plan, which you'll receive resources, research, practical tips for reducing harm as far as your cannabis method of consumption, how to choose quality cannabis. We'll go through your health and personal history with cannabis as well. And that's just the basics of what we go through during the consultation. And I also offer follow-up consultations and in-person doula services. And you'll also receive information about, can you see it? Sorry, you can't see it, but it is the Cannabis Safe Zone that I've established. It is an acronym for how to choose quality cannabis and consume quality cannabis every time, especially when you're pregnant, or if you're using cannabis to treat your condition. Then I definitely think that this strategy will help you in choosing quality cannabis to consume every time and making sure that you're getting what you need. And I also talk about my cannabis sommelier services that I'm offering as a certified professional interpreter. So I'll talk more about my events and some things that I have coming up for 2020. So definitely tune into the webinar if you are interested. But really quickly, I want to talk about what is cannabis used for, especially during pregnancy, childbirth, and postpartum. How is cannabis used? So during pregnancy, cannabis can be used to treat nausea and vomiting, especially hyperemesis. If you suffer from severe nausea, that's one of the main reasons that women use cannabis during pregnancy. Also, depression associated with pregnancy, any anxiety that you may feel can be alleviated with proper cannabis use. Also, any physical or mental discomfort that you may be experiencing, and also insomnia related to sleep, or if you need like energy during pregnancy, cannabis can also help with that. There's a variety of cannabis is on a spectrum, so there's so many types of cannabis, so many methods of consuming it that you can incorporate into your lifestyle to really help you in your journey, whether you're pregnant or journeying through postpartum. So during childbirth, obviously we talk about pain management as one of the biggest uses of cannabis during childbirth. Obviously, you want to alleviate pain that's associated with the process of giving birth. I don't think of pain the same way a lot of people do, so I believe that we should kind of reframe our language a little bit from pain to talk about comfort management. Or if I'm talking about comfort measures, I'm speaking on managing pain during the process of giving birth. So cannabis can definitely be used as a comfort measure to reduce hemorrhage after giving birth as well. So some of the things that are used now in reference to pain is the epidural. And we know that the epidural isn't as safe as we would like it to be. And there's a lot of side effects associated with the epidural that are harmful to mom and baby. And so cannabis can be seen as an alternative to or as a natural method for pain management and also for relaxation as well. So just getting out of our head and really focusing on the act of giving birth, I think cannabis really creates that spiritual atmosphere that is like essential for giving birth without pain, and which is, I call it like a spiritual birth, which I'm an advocate for. And postpartum, obviously we talk about postpartum depression, like I said, reducing hemorrhage. And when we're talking about reducing hemorrhage, one of the things that is often used postpartum for that is Pitocin. And Pitocin is also used to induce as well. And cannabis can be used in either regard as an alternative to Pitocin if used correctly. So I'm not saying go out and, induce yourself. What I'm saying is get educated on different methods of consumption, different types of cannabis, and how it can be consumed properly. So, definitely get an individualized consultation. Don't take any information that I'm saying and run and go smoke and try to induce your birth or anything like that. Please, that's definitely not what I'm saying. That's why I don't usually do videos like this, just giving out information, because it's not a good way to reduce harm. And as a doula, that's like one of my main concerns. I don't want to give out too much information and you use it to do something and you end up hurting yourself or your baby. And that's definitely the last thing I want. So I want to make sure that I'm clear. I'm a doula. I'm a childbirth educator. I'm a certified professional interpreter. I have 2 other certifications in cannabis. I am not a medical doctor, and I'm not giving anyone medical advice. I'm just offering education about cannabis use during pregnancy, childbirth, and postpartum. I offer this information primarily through consultations, full-hour consultations. You can think of it as like a doula consultation on cannabis. So I'll be talking all about cannabis use during that time, and doing so in a very individualized and personalized way. So just making a generalized video about the topic of cannabis use has been done, and you can find it online. But if you're actually seeking individualized support from someone who has worked in cannabis, who advocates for cannabis use, who is a doula and childbirth educator, and who has given birth 2 times to cannabis babies, then follow the Cannabis Doula on Instagram. You can schedule consultation at thecannabisdoula.org. And feel free to email me if you have any more questions. I'm also going to be advocating for cannabis use to treat menstrual pain and menstrual cramps, and kind of elevating us during our periods. So that's one thing I'll be talking about this year as well. So feel free to shatter the stigma all 2020 with me, the Cannabis Doula. And if you have any questions, please let me know. Please tune into the webinar if you want access to the webinar on harm reduction and risk management. Feel free to email me to get the password, and I will talk to you soon. Stay high.